name is Gabe Cochard, and I've got an interesting story to tell you guys. So 21 years ago, on May 5th, my parents gave birth to their first set of triplets. However, when my mother was pregnant, one of her babies was diagnosed with hypoplastic left heart syndrome in the womb. 7 days after birth, my brother Isaac was in Riley Hospital receiving heart surgery. Now, I'm sure you guys are probably wondering, why am I here? Well, to answer that, I've been hearing about Riley Children's Hospital my whole entire life. And in addition to that, I'm a nursing student. So I hope one day I'll be able to work at a hospital just like Riley. Now, you're probably also wondering, why does this matter? I'm looking out at you guys and most of you look like college students. I'm assuming you don't have kids. So why would you care if you don't have kids? Well, to convince you that Riley matters, I'm going to talk about the need for high-quality children's hospitals in America, what Riley is and what they do, and the community impact and the impact they had on my family. Now that I've introduced myself, let's talk about the need for high-quality children's hospitals in America. So when I served in my Communications 210 class, I wanted to know what they knew about birth defects in infants. The results were a bit of a toss-up. They didn't really know. Well, to answer the question, the CDC reported in 2012 that 1 in 33 infants are born with congenital birth defects, which adds up to about 120,000 a year. And you're probably thinking, okay, so? Well, when I surveyed my Communications 210 class, 100% of them said that they would do something about the number of infants dying in the United States. So, the CDC reports that 124 infants die per year out of 100,000 due to congenital defects. And the March of Dimes further reports that 12 per 10,000 infants die every year, which adds up to about 4,800 infants in the United States. So, if you guys think anything like my Communications 210 class, you would agree that we need to do more for infant mortality, and that you would do something about it. Knowing that 4,800 infants die in the United States of congenital defects every year, you'll want to know about Riley Children's Hospital and some of the services they offer. According to RileyKids.org, Riley Children's Hospital was the state's first pediatric hospital. It opened its doors in 1924, and since then, doctors and scientists have been working hand in hand to move the newest procedures to patients' bedsides. And in 1997, one of those new procedures was the Norwood procedure, which was performed on my brother. In an interview with my mother, Gabe Cochard, she stated that my brother Isaac received the Norwood procedure at Riley Children's Hospital, which at the time was only 15 years old. It was relatively new. And in addition to that, Riley was one of 10 hospitals in the United States that offered the procedure. And Dr. Brown, the physician who performed the procedure, was the second best in the nation. Riley offered that chance of survival to my brother because they had access to the newest technologies and procedures. And according to RileyChildren's.org, Riley Hospital is a national hub for children's research, and 2 of its leading programs are the Riley Heart Program and Newborn and Maternal Health Programs. Riley Hospital offers these programs to help infants survive congenital birth defects. So, now that you know about Riley and some of its services, I'm going to talk a little bit more about the community impact and how it impacted my family. According to the IU Community Impact Report of 2016, Riley Children's Hospital saw 50,000 emergency room visits, over 300,000 patients, over 10,000 surgeries, and of all those patients, 3,162 patients received reduced care costs or free care. Now, you guys are looking at that, it's just numbers. Wrong. They're actually families. It could be your family. And in 1997, it was my family. My brother received the Norwood procedure at Riley. And according to Patty Nyman, from National Public Radio in 2010, the survival rates of the Norwood procedure are about 70 to 75% by age 5. Now, I never finished my story from earlier. Back then, the Norwood procedure was relatively new, and survival rates were significantly lower. My brother Isaac died at 7 days old. Most of his life was attached to tubes. My parents couldn't even hold him. And the only picture they have of him without tubes is in the funeral home in my father's arms. It's not fair. No parent deserves to go through this. And it can impact anyone. It could be your family. Riley offered hope to mine, because without the Norwood procedure, hypoplastic left heart syndrome is fatal and accounts for 25 to 40% of all neonatal cardiac mortality. So, I guess the only question is, why wouldn't you care about the hope that Riley offers families and the chance that Riley gives children? Overall, I spoke about tons of stuff. Why we need high-quality hospitals like Riley, and the services Riley offers, and how it impacts our community and my family. And with the money in that red bucket, we can impact families like mine. We can impact families like yours. We can prove that we care by saving those families. My parents lost their little boy. Other families don't have to. Let's show that we care. Thank you.